Welcome to the Security Speakeasy Show, where we talk about all things network security. In the last episode, we talked about why securing medical devices is hard. And in this episode, we'll talk about key steps to consider when thinking of securing and protecting those IoT or other IoT devices. And also, we'll talk about things to look for when you're comparing IoT security solutions in the market. And finally, how Palo Alto Networks IoT security solution can help our customers. My name is Minakshi, and I'm on the product marketing team here at Palo Alto Networks. Joining me today is Mark Beck with more than 15 years of experience in healthcare industry. His most recent role has been the healthcare security architect supporting healthcare verticals and customers and sales globally. Welcome, Mark.
Hi, Meenakshi. I'm happy to be here to talk to you again. During the last session, as you mentioned, we talked about why this was a problem, what healthcare organizations are doing today to address the issue, amidst all the challenges that we had discussed. As a product marketing manager of our IoT security solution, can you share a little bit about, what you see from your side? Because I know you think about how we should help our customers deal with this problem every day as well. So I would like to sort of turn the table and ask you what you see from your side in terms of what is the best approach to address the issue today. Can you share some of your thoughts?
Of course, Mark. So just to give some brief context, Palo Alto Networks has worked closely with NIST, the Department of Health and Human Services, commonly called HHS, and other global standard organizations to help kind of shape vendor agnostic best practices for securing IoT and IoMT devices. So we've also come up with a kind of a practical guide or framework for clinical device management and security. For our audience, who like visuals, I would like to share a slide here. So this particular slide kind of gives a kind of practical step-by-step guide for clinical device management. The first step begins with identification. So you have to know what that device is. Is it your security camera? Is it your smart badge reader? Is it an infusion pump? Is it a healthcare monitor system, or any kind of other medical or non-medical devices? So identification is the key. And then you also have to look at how you're identifying those devices. A lot of those devices don't like active probing, so that identification needs to be passive. And the next step is, how you're onboarding those devices safely onto the network. So some of our customers or some organizations, they try to map to their asset management systems or ITSM databases. They're trying to make sure, those devices are captured there. And then also to put or place those devices in proper segments. A lot of organizations use either firewalls or network access control or NAC solutions for segmentations. So once you have onboarded those devices safely, the next is the IoT security lifecycle, and that's the cycle in the middle. So once you've identified, you understand the IoT assets, you understand those medical devices context, the classification, next is assessing those risks. So you have to make sure, what type of risks those devices pose. Are they patched? Are they not patched? What kind of protocol they're running, and what type of antivirus or some other kind of, or even patient PHI data that they contain. Is this device has been FDA recalled or not? So just having that deep assessment of IoT devices or IoMT devices is key. Once you know that, and you will, maybe we'll talk about later how other vendors, they kind of stop at identification and alerting, but you also have to have a solution that comes up with, be able to apply risk reduction policies. So in the framework, the solution needs to provide you risk reduction policies based on all that assessment, all that risk assessment. What is the intelligence behind it? How do you actually apply it to your system? And then finally, you have to be able to prevent known and unknown threats. So once that security lifecycle is complete, then another piece of the puzzle is that a lot of especially biomed engineers who are the users of these products, they are always looking to optimize the working of these or the functioning of these devices. They want to make sure if a particular machine is underutilized, overutilized, that to make sure they are optimizing the patient care. And finally, the last piece of the puzzle is retirement. There are, you had alluded to it in our previous episode as well, there are different kind of teams. Some teams are in charge of procuring a device, some teams are in charge of, securing a device. So making sure that whosoever that team is, when they're retiring that particular medical device, there is no patient data on that. So making sure that they are retiring them safely. So this is the kind of a practical guide or the right methodology for clinical device management. Now that I kind of talked about the clinical device management framework, Mark, so do you have any best practices advice around when organizations are evaluating IoT security solutions or just beginning that journey?
Yeah, for those organizations, well, I mean, just about all healthcare organizations actually that I've dealt with really struggle from having too many security and network tools that may surface the problem in forms of alerts, but are not capable of enforcing policies, or they have not been configured to do so because they require a third-party integration enforcement systems from another vendor, for example. For most of these organizations, it's really not easy to spend efforts to integrate and maintain those integrations over time. And when problems arise, it makes it much more difficult to troubleshoot problems between multiple systems and vendors as well. So I see a shift from the traditional best of breed approach when it comes to IT and security products to best of platform breed from the industry, where a consolidated platform approach that minimizes efforts from the healthcare organizations to quickly operationalize these tools and make it easier to maintain and scale as need be, which would also save cost over time. And with the industry having challenges with not having enough security professionals in-house, I think it is imperative that they evaluate products' ability to automate tasks and reduce the work your staff will need to perform. So they can focus more on proactive activities, such as on your architecture, your engineering, and maybe even threat hunting. Attackers have been leveraging automation for a while now, and organizations can no longer really keep up with these attackers without leveraging automation themselves. So healthcare organizations should really take this into consideration and leverage solutions that maximize the use of automation and enforcement. Now, having said that, Meenakshi, why don't you share a little bit about what Palo Alto Networks is doing to help our healthcare customers with their IoT security solution today, and what makes it unique compared to others?
Of course, Mark. Palo Alto Networks, all of us, including you, we feel passionately about security. We are in the business of protecting, the digital way of our customers' life. And to that end, we offer the healthcare industry's most comprehensive IoT security solution, delivering, ML-powered visibility, prevention, enforcement, and operational insights, all of them in a single platform. And we are the only ones in the market to deliver built-in prevention, ensure quick and accurate discovery, offer effortless deployment, and enable maximum patient ROI and experience. So I just wanted to kind of just briefly talk about our solution. Of course, if audience is interested in learning more, they can go to our IoT security webpage and learn more about our detailed features and capabilities. So this brings us to the end of this episode. I recommend our audience to read the Healthcare CISO's Guide to IoT Security. So the guide explains how you can protect every device with a 6-step approach to clinical and device workflow management. So thanks for viewing, and see you all in the next episode.